Dr. Luvindao was responding to an LPM MP Enias Mvula's question with regard to ongoing concerns that despite the award being implemented in 2023, some medical interns continue to feel sidelined from full employment benefits. Minister Luvindao, however, emphasized that under her leadership, interns are not currently facing such exclusion. She said the ministry is developing a proposal to introduce fixed overtime payments for medical interns.
Our stance is that medical interns are entitled to fair compensation, particularly, as I mentioned, because throughout the country, at least in Namibia, they run a majority of the times when you go to a hospital, you will find a medical intern is the one present and doing a lot of the heavy lifting. With that said, in light of this, the ministry is actively engaging, as I mentioned, with relevant stakeholders, including representatives of the interns, as well as their legal representation, including the Ministry of Finance, Public Service Commission, to develop a proposed framework for the payment of fixed overtime.
Dr. Luvindao also acknowledged the emotional, psychological, and physical strain that these prolonged processes may have placed on the affected interns. She stressed that the delays are not due to reluctance or unwillingness on the part of the ministry, but rather a result of the need to carefully navigate legal and administrative frameworks involved.
The ministry takes very seriously its duty of care toward all healthcare workers, and in this case, particularly the interns. In light of this, the ministry is committed to the following. Firstly, accelerating consultations. As I mentioned, the longer we take, the more interns suffer. And so therefore, we commit to accelerating consultations with relevant stakeholders to resolve outstanding matters affecting medical interns, enhance access to psychosocial support services. As you've rightfully so mentioned, this has more than just the financial impact, including counseling for all affected personnel through the existing Employee Wellness Program extended, and then assessing options for medical support and treatment where appropriate for interns facing documented health issues arising from work-related stress.
She said her ministry is committed to ensuring a safe, respectful, and supportive working environment for all healthcare workers and welcomes continued dialogue on measures to improve the mental and physical health outcomes of its personnel. Yoleni Shapela, NBC News, Windhoek.